Hi, I am Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department. It is July 1st, and this is our COVID-19 update. And I'm here again with Dr. C. Do you want to say hello?
Hi, everyone. I'm Dr. Corriveau. I'm the Deputy Health Officer at the UG Public Health Department.
All right. Well, thanks for being back on our little video update. We have a bit more of a serious topic today. We're going to talk about the Delta variant of the virus that causes COVID-19. It's something I think people are hearing about a lot in the news. So are we seeing the Delta variant in Wyandotte County?
Well, Janelle, it's a good question, and unfortunately, we are seeing it. We have confirmed 22 cases at this point in time of the Delta variant. I believe the first case cropped up around the beginning of May, but we didn't have that sequenced until just recently, so we were not knowledgeable about it until just recently. The Delta variant is really worrisome to us, and it's because it seems to spread far more easily than any of the other variants or the original COVID virus that we've been fighting for a year and a half now. So we're especially afraid for those people who haven't received a vaccine yet, because there's really no protection there. You know, many of the cases that we've seen of the Delta variant in Wyandotte County happen to be in people who are younger than 30 years of age. We have seen the Delta variant in kids as young as school age and even up to adults in their 60s. But again, most of them are folks who are in those younger populations. So again, just want to urge people to consider vaccination for COVID-19. We have a lot of assurance that especially the Pfizer vaccine and the Moderna vaccines are both very protective against the Delta variant. And so I would encourage you, if you haven't gotten one, to just go out there this weekend and start that process, because it's really, really getting to be important.
Yeah, thank you so much for that. So like you said, we definitely want to continue encouraging people to get vaccinated, and our vaccination rates in Wyandotte are still not where they need to be. And we do still offer free vaccinations, no charge. You don't need health insurance. But there also are a lot of other community locations that offer vaccines, maybe a pharmacy near you or another place that's convenient for you. What else can people do right now to help protect themselves and the people around them?
That's another great question. And we're going to get back to the basics of how to prevent transmission of COVID-19. Some of these things we've been talking about for months, more than a year now, and it really hinges on, especially if you have not been vaccinated, you really need to wear a mask. You really need to wear a mask in order to protect yourself, but also to protect others around you, especially in indoor public settings. It's very, very important. Also, if you have an issue with your immune system, if you've been ill, we encourage you also to wear masks, whether you've been vaccinated or not. We feel like that's still probably a really good idea. And for anyone, if you've been vaccinated or not, if you're not feeling good, we still offer free testing. And we feel like it's really important to get tested. The type of COVID-19 testing that we do is really easy. You just spit in a tube. And so no longer are we doing those kind of uncomfortable nasal swabs. That's not the case at all. And this is something that you could even take home. You could spit in the tube at home and bring it back to us, or just drop it in a local drop box and we'll process the sample.
All right, great. Yeah, we have that testing available at our site out at the old Kmart building. That's actually offered now. We're back to Monday through Friday hours for that, from 9 to 3. And additionally, you can get a test brought to your door. You can call 311, or you can go to our website, wycovaccines.org, and there's a request that you can access to say, hey, bring a test to me. So it's that easy now to get tested if you need to. And again, it's free. All right. Any last thoughts you want to add about what we're seeing with COVID in our community right now?
Well, I think I'll just say that we're nervous right now a bit about this variant. We're seeing that some communities, especially in Missouri, have been hard hit, and they're seeing that their healthcare providers are also hard hit. So there's a lot of sick people and communities around us. So just one more time, going to urge you all to consider getting your vaccine sooner rather than later. We know it's protective against this Delta variant because we're worried that the Delta variant is going to start to move at a higher pace in our community in weeks to come, but we'll keep you all updated.
All right. Thank you so much. We'll see everyone next time.